My name's Stephanie. Does everyone have one of these? In the back there, you have one of these? Okay. All right. So my name is Stephanie. Louisa asked me to join your Little Talk session. I'm from the Agency on Aging. So I'm just going to go through some of the things that we brought here along to go over today. And then we're going to dive into playing Medicare Jeopardy. It's just a way to make Medicare a little more fun. So don't feel embarrassed if you don't know everything. I don't know everything up there. I'm a choices counselor for 6 years now. So there's no way that you're going to know everything about Medicare. It's always changing, okay? So this is our brochure here of the agency. It has our contact number here. So if you have questions after today, feel free to reach out to me. Again, my name's Stephanie. I think kind of does an overview of the towns we serve, the services we offer, but I'm going to go through that with you guys. We serve New Haven, East Haven, North Haven, West Haven, Brantford, Guilford, Madison, Ansonia, Derby, I might get them all, Shelton, Hamden, all the way down to Milford. We stop at Shelton, I believe. So, but somebody asked a question earlier that I want to just have everyone kind of hear the answer to. We're not the State Department on Aging. The State Department on Aging is a department with the state of Connecticut. We get funding through the State Department on Aging, but we're actually a private nonprofit, and we get our funding through the Older Americans Act of 1965. I'm not going to go into any more detail with that because it's, you don't need to be bored. But, okay, everyone has this sheet in front of them. So if you want to reference that, I'll go over briefly what the different programs are and what we're about there. So the Aging and Disability Resource Center, that's the department I work in. So anybody can call. Really, anybody can come through the door, and we're not going to turn anybody away. We will try to help everybody. And when I say that, it doesn't, the name is misleading, the Agency on Aging. We help people 18 and up. So my main job is to help people with disabilities. I've had some people that were younger than I am that were my clients. I'm 27, so it's, we'll help anybody that we can. In the ADRC, the Aging and Disability Resource Center, we have the Choices program, which of course is our state health insurance program. That's what we're here to talk about basically, mostly today, is the Medicare. We have options counseling, so that's my role. I help people with disabilities kind of look at what are they eligible for, what are their goals long term. We have the caregivers support and respite programs. So we actually have people that are professionally trained in how to deal with caregiver stress. We have some workshops that deal around that. And then the respite program is for caregivers who are over 60 that need a break from caregiving. Health and wellness, we'll get into a little bit more of that, but we offer different programs like disease management or education, exercise programs like Tai Chi, and then the Meals on Wheels program. Advocacy for Hispanic and Latino elders. We actually have, we call it HOPE. It's our Hispanic Outreach Program for Elders. And there's a woman named Janet that works in my office. Is anybody in here Hispanic? Okay. Does anyone have any Hispanic friends? Okay. Well, for those not here that might, if you know somebody in the community that could need help, sometimes there's language barriers that prevent them from getting the services they need. So send them to us and we'll be glad to help them. Senior Medicare Patrol and Elder Abuse. So this is if you get a bill statement, not a summary notice, they're two very different things, but if you have a bill statement that says that you saw Dr. Johnson for a colonoscopy, but you never did, and you never had a colonoscopy, that's something that could be a clerical mistake from the office, or it could be fraud. So we actually have a person at our office that's an expert in cracking down on Medicare fraud. And if you guys, in your past lives, whatever careers you had, if you did something like that, investigating things or just really like clerical stuff, you could even volunteer for that program and be on the task force for that. The last thing I want to say about the Aging and Disability Resource Center before moving on to the next section is we have the Social Security Disability Assistance Program. So this is something that we created because in our current state in the country, it's so hard to get disability. Like my mother had it for she applied, I think, 3 times and was denied every single time. And she has multiple, you can be denied up to 5 times actually. So usually by the 3rd time you get an attorney, but attorneys charge a lot of money, and it's something that it's really hard to get. You know, and it's a judge that makes a decision. And sometimes people applying for the disability, they could find jobs, so that's really why you can get denied up to 5 times. But there's a lot of cases where somebody is disabled and struggling with it's a lot of paperwork. So we have an attorney that we've kind of brought on, created this program to help people with that. And she's a pretty good judge of character. So if it's somebody where, you know, they really could find work, but maybe just has some lower back pain, like she'll try to help them reason and see what job could you do, because that's exactly what Social Security is going to end up doing anyway. Moving on to the volunteer and training department. So this program, or this department, it's about the same size as the Aging and Disability Resource Center. There's about 10 to 12 staff in it, and what we offer is volunteer programs for older adults. So my favorite one of these is the Senior Companion Program. So it's something where a lot of times you see it in the community. Maybe you have a neighbor or a friend that's like 20 years older than you, and they need a little help with their groceries or bringing out the garbage, or just it's seniors helping seniors. We have the Follow Me Home, people being discharged from the hospital that need help at home and don't have enough of it. The foster, my favorite is the foster grandparent program, because some of you may have grandkids, some of you may never have had the opportunity to have them, some of you may not be able to see them because of custody issues, but this program allows you to volunteer as a grandparent for a child that doesn't have any grandparents. And I just think, I have all 4 of mine, and they're 4 angels in my life, but I think about the people that never had grandparents or never got to know them, and I think it's just something, it's great to have that intergenerational relationship. So there's a few other things you could do, like go to the schools and tutor children. There's also senior training and employment. It's the STEPS program, so if you're looking for help finding a job or trying to brush up on computer skills to get a job, we have a program to help with that. On the back side, I know I'm breezing through this, so I'm sorry. If anyone has questions, feel free to cut me off. The care management department. So this is what a lot of people, when they think of the Agency on Aging, they think of the home care program. So that is a program through the state that the goal of it is to keep people in their homes out of the nursing homes. So there's different income asset requirements. We're not gonna get into that today, but if you guys have questions or want to know more, feel free to call us and we can give you those little facts there. Some of the other programs are like the PCA waiver, personal care assistance waiver, community first choice. Those allow you to like self-direct. So if you're able to say, I need a nurse 3 times a week, I need a home health aide twice a week, and I need a companion to help me grocery shop once a week. If you can do that, the state actually gives you the money to pay that person. Again, you have to be at skilled nursing level care. So this is what allows you to stay home. Money Follows the Person is an interesting program. So it's people that have gone into a nursing home and don't want to be there anymore. They want to go back into the community. And I actually had a guy that I got help get onto this program because he was a quadriplegic, and his wife that was taking care of him left, and so he couldn't take care of himself anymore. So he went to a nursing home, but he hated it. So he spent a year in a nursing home, but now he's back out into one of our local communities, and he's thriving at home because of that program. So that's that. Does anyone have any questions about this? I should say just one more thing. On the bottom, you see this Care Network Link logo. That's another entity that we created. Because the home care program, you have to be at Medicaid and skilled nursing level of care.
Can you point that here?
Yeah. Yeah, down on the bottom, Care Network Link. So that's if you have income or assets that are over the home care limit, and you need to, what they do is spend down. That's something where you can purchase the services through providers that we've investigated, contracted with, and put our seal of approval on. There's a lot, I think there's like 250 home care agencies in the state of Connecticut right now. That's the last number I heard, but some of them maybe don't have as much experience. They may have the credentials, but it doesn't mean, you know, they're popping up a lot, so.
Stephanie, on money follows the person
Yes.
or an individual who's in a healthcare facility who's looking to be discharged into the community with services, they need to apply for money follows a person while they are inpatient.
While they're inpatient, and the
Right.
social worker at the nursing home should actually be the person making that referral.
Right, okay.
And they can do it online. Okay, so, I talked about some health management programs. This next page is a flyer about an upcoming diabetes workshop that we have. So if you guys know anybody that's diabetic, or if you have diabetes yourself, or are a caregiver for somebody with diabetes, this would be a good thing for you guys to attend. It's 6 weeks long. Okay, so it is a time commitment, and it's from 1 to 3:30. In my experience, they usually end a little early. So, you know, to say 3:30, that's just, you know, the time that we have booked for it. But it does help with things related to diabetes, and also just things in general that people struggle with, like communication breakdowns or dealing with depression, like things that everybody experiences throughout their lifetime at least once. Speaking about depression, so this is a flyer. It's not really, I mean, it's for our program, Healthy Ideas. And Healthy Ideas is a program that we have that we help older adults dealing with depression. So we'll do a depression screening using the geriatric depression scale, and then we'll work with that person and linking them to services or treatment, or even, you know, my favorite piece of it is helping people learn how to do meaningful activities again. So sometimes it just takes, I don't know if we have any knitters in the group, or like, I like walking on the beach and collecting sea glass. So if I'm having a rough day, I really, like today would be terrible for it because it might rain and it's really sticky out. But if I was having a rough time, look for something that I enjoy to do, because what that does, it makes you feel better, and then eventually breaks that cycle of depression. Okay, so this is the fun stuff that we're getting into here. And then I promise we'll play Jeopardy. This is something that's just useful to have. It's Medicare options for 2017. So, you know, brief rundown. We're going to learn a lot of this during the game that we play. But hospital is Part A, and everybody in here is on Medicare, right? Is there anybody not on Medicare? You're not on Medicare. Is that because you're still working, or do you have a spouse's insurance?
I think I'll be getting it next year.
Okay.
Age-wise.
Okay. Oh, you're not 65 yet. So if you get Medicare because you're 65, or
Can you get it before you're 65?
if you're disabled, if you become disabled and you've been on disability for 24 months, or if you have end-stage renal disease or ALS, which is Lou Gehrig's disease, those are the things that qualify you for Medicare before 65. Now they changed the retirement age, but they didn't change the Medicare age, so it's confusing. But hospital Part A is free if you work. Part B right now is $134 a year, so you know, a month. I'm sorry. Yes. I wish it was $134 a year. It's per month, and a lot of you may have seen an increase in it the past few years. I think since I've been working, it started at $99, and then it went to $104.90, and then it went up to $121, and now it's at $134 a
Changes
month.
every year, like you said.
It does, yeah. And the federal government is the one that decides
That's
that.
what we're looking at, like my generation is a baby boom,
Mhm.
quite a lot of us.
Yeah.
And we're talking about Social Security,
Yeah.
if it's gonna, this group, if it's going to be there.
Yeah.
That's another day's story.
Might want to get Social Security in on that one.
What premiums are they deducted out of your Social Security check?
The Part B premium is, the Part A is usually free. Okay, the Part B premium, if you were not retired yet, like if you're still working but you're taking Medicare, and you're not collecting Social Security, they'll bill you quarterly. So you'll get 134 times 3 in a quarterly check that you'll have to pay. Which we'll talk about. There's programs that help pay for that, so we can definitely dive into that. But just briefly at the bottom, ignore the numbers because they're different for everybody. If you guys have questions about specifics, call Choices, okay? Or if you have Choices counselors within the town, I think we have some set up in North Haven. But you want to deal with a Choices counselor. Sometimes brokers aren't always in the know, and brokers get commission on plans, so I'm not discouraging you from seeing a broker that you've had for the past 10 years, but come talk to us and just see if what we're offering you as far as your plan options are the same as what they're offering. Because I've seen it a lot where somebody is spending like $400 more a month than what they need to be because the broker said to. So again, I'm not saying brokers are bad, I'm just saying we give free Medicare options. And we're not going to tell you this one is better than the
Are
other.
you talking about private insurance?
Yes, ma'am.
brokers?
I'm talking about agents,
Like
insurance agents.
Hartford or
I have no idea, I don't collaborate with them.
then the private?
Yeah,
So
okay.
those are the ones who say broker and we'll get compared.
People selling insurance. Choices, if somebody is a choices counselor and they're trying to sell you insurance, they're not a they're not a choices
It's a
counselor.
scam.
So if you do hear somebody that's a choices counselor and they're trying to sell you something,
It's a scam.
call us, because that's not somebody affiliated with us. We get grant funded, as we previously talked about, okay? So option 1 is just Part D plans in addition to the traditional Medicare, which we call A and B. Option 2 is supplement plans. Does anyone have a supplement or Medigap? Yeah, see, I see a hand there. So they're expensive, but they are great. My grandparents have them, they go anywhere. I think my grandpa was in Virginia at Myrtle Beach and he fell, and he was able to go to the hospital and didn't have to pay a dime. Because if he would have had an Advantage plan, like option number 3, you have to go in network. So supplements are good to have. They are pricey though, so it really just depends on what your situation is. All right, now I'm going to breeze through this one. The most important part here, I think, for everyone to see is the stuff in green. That's our Medicare Savings Program, okay? That's through the State Department of Social Services. There's different income guidelines, but you'll see there's no asset limit. What this program does is pays that $134 premium. So if you're not having the Medicare Part B deducted from your check, chances are you're probably on this program, and you'll get an annual redetermination each year for it, okay? There's different levels of it, and that's, you can clearly see that. But again, no asset limit. And then below it, you will see, the food stamp is in yellow. In the purple, that is Social Security Extra Help. If you're over income for that, which most people are, that goes off the federal poverty limit. If you get the Medicare Savings Program, the one in green, you automatically get the purple, okay? The reason it's purple is because that's the letter that they send you. Social Security will send you a purple letter once you've received extra help, okay? So that's why we coded it that way. All right, does anyone have any questions before we jump into playing Medicare Jeopardy?
It's not too confusing.
It's okay. When I first took my training to be a choices counselor, it was 4 days of all-day training, and they have attorneys come down for the Center for Medicare Advocacy, and they teach you. And I felt like I had spaghetti brain. Like I have a 3.85 GPA in grad school right now, but I could not handle the Medicare talk 4 days in a row. So if you guys have
One changing.
they do. So today's gonna be fun, at least this portion of it. We got through the boring part. So I'm not gonna divide it up into teams or anything. It's just gonna be something where if people wanna participate, fine. If anybody is participating too much or being like a Jeopardy hog, I'll make sure I mediate that. But the reason for not doing teams is I think it makes it too competitive, and this is supposed to be fun.
I don't know what you're talking about. What are you trying to do?
We're gonna play Medicare Jeopardy. So it's a game, just like everybody knows Jeopardy, right? Okay, so I don't have the music up here. Just do it in your head. But so the first column is Medi. So it's Medi blank. So we just spent a good portion of the morning talking about Medicare. So you get it, right? When we're talking about A, B, C, D, that's talking about the different parts of Medicare. You guys have some answers in front of you with some of the materials, just as a hint, okay? Preventive benefits, so we're talking like mammograms, the flu shot, things like that might be in that column. Fun with acronyms and potpourri, there's some tough ones in there, but there's also some fun facts. Again, I don't know everything on this, so don't feel bad if you don't either. It's really just to kind of get you guys more familiar with it and have a little fun while refreshing your brains about Medicare, okay? Whose birthday does anyone have a birthday that's close to today, August 15th? When's your birthday?
July 16th.
July 16th. Anyone closer than that? July 25th?
August.
August 25th. Okay, so you're closest. Anyone? No? All right, you want to go first? Pick the first category.
Underactivities over 1,000.
Okay, going right for it. All right, here we go.
Get the little petty stuff.
All right, Cobra. Good luck.
Oh, you know this.
And it's not a
You do
snake.
know this.
It's not a snake, it's.
It's not the snake. This is a tough one.
Something with the insurance.
It is something with insurance. So what we're asking what it stands for, which honestly I don't know the answer to that. So if any of you guys do, you can have my job.
I know it had to do something with health insurance.
It is something.
I've heard it.
It's the health. Does anyone have an idea what it stands for? It is the health insurance for when you lose employment. Your employer gives it to you. Okay. So here's Consolidated Omnibus Budget Reconciliation Act. So it's a tough one. But thank you for yeah. Okay, and then we could just go around. I think if everyone just have some kind of order. So we'll go to you next in the white sweater.
Claire, pick
Claire.
one. Pick one.
Pick anyone.
We're playing Jeopardy.
Yeah, so you could have Medi, ABCD, Preventive Benefits, fun with acronyms or POPO.
Oh, great.
Okay, for 200, 400, 600, 800, or 1,000.
Oh my God, I'll pick 1,000.
You want to go? Okay.
And not flying around here.
Okay. You guys should all know this.
Do you know?
Yeah, we heard it. What is Barack Obama, right?
Your turn now, everybody knew that
Who
one.
was, I thought you wanted the year.
Okay. All right, sir?
Yeah, I was just wondering, I retired 4 years ago,
Mm-hmm.
and when I was working, I was getting $1,100 in Social Security. When I retired, now I'm making $7. And I can't get a straight answer from anyone, even Social Security. I went there 5 times, and I
Not,
get a different answer every time.
yeah.
They don't know why.
You're getting 700 in Social Security now that you're
Yeah.
retired?
Yeah, I was making over 1,000.
Were you on disability before?
No.
No.
See, I'm not sure how to help you with that, other than document who you speak with at Social
I mean, I get a
Security.
pension too,
Okay.
but I
That's not my area of
I wonder where the
expertise.
$400 a month.
Yeah.
Only Social Security can tell you
Yeah, it's
that.
really not my area.
I was there 5 times.
Document who you speak with and then ask to speak to a supervisor.
And if you want, I can talk to you again about that. That's not a problem.
Would you like to choose a topic?
Go ahead, be a risk taker. Go for 1,000 and something.
Yeah, go for 1,000. They'll feel
I'll go for
better.
800.
And what column?
Preventive.
Preventative for 800? Okay. Okay. So this is how frequent you have your cardiovascular disease screening. Is it every-
How often do you think it would be? Once a year, once every 5 years?
Okay, so we have what is once a year? It's actually once every 5 years.
Wow.
You got 4 high-risk years.
If you have something like a already precondition of that though, then it's different. So I just want to clarify that. These are preventative benefits. So if you have heart disease already, you're past the prevention part. Okay?
Well, that's where you go to a family doctor, you get an appointment, you should be listening and checking, because that's a preventive care, or going under some machine.
So cardiovascular screening is a little different. That's something where you go to a cardiologist, I believe. It's not something a primary care would do. In the green here, Miss, would you like to?
Yeah, preventative benefits for 600.
Okay. Okay, this is
Every other year.
well, this is actually the name of the test.
Oh,
Oh, not how often.
It's every other year.
Bone density?
Bone density.
Yeah.
What is the bone density? I think, yeah, bone mass measurement, same
Now, at
thing.
my age, they would say every 5
Okay.
years.
We're not asking the frequency, we're asking the name of it. And I'm not skipping over you, I'm just gonna, actually, you know what, why don't you pick the next topic and then we'll move to the back. I don't wanna have them miss out.
We'll go for preventative for 1,000.
Okay.
Oh, such risk takers.
I know, I've never had such a big group of go-getters. Okay, so this is the age when a female is first eligible for a baseline mammogram.
I go 20.
I think it's,
What are you thinking?
What is
I
40?
think it's 50.
What is 50?
50.
Does anyone else over there have anything different? We have 40 and 50.
I'm thinking it's 40 as well.
20, okay. It is actually 35. They changed it.
35.
Mhm.
Was it younger?
It was 40. They changed it.
I
Oh,
remember where I lived.
oh, hang on, guys. Technical difficulty here.
35.
Oh, my goodness. Okay.
What happened?
Okay, there we go.
Nothing.
The game.
We got it.
Nothing happened. You saw nothing.
Okay, and so, sir, I'm going to cut to you here in the back. Would you like to pick a topic? No, you're going to pass?
Can't hear it too well.
Do you want to pick a topic up on the board?
What's that, man?
Do you want to pick a topic up on the board there?
I'm just listening.
Just listen, okay. All right, we'll move on over to you, ma'am. You don't want to pick
Pick
one?
one. Try 1,000. Everybody else is being risky.
Yeah, we didn't get nothing out of it.
Okay, we'll try ABCD for 1,000.
Money.
Okay, so this again, remember, we're looking for Part A, Part B, Part C, Part D. What is this one? Remember, you've got the answers in front of you.
But run by private companies. Okay, so that's what we're talking about.
We're looking
It's
for,
not like you
I want you
So
to hear,
A is for hospitalization.
I'm thinking of Humana.
No,
no?
not a company.
What's another word for a Medicare Advantage plan? HMO is correct, right? But it's also called something else. And it's not Part A, it's not Part B,
Or D,
it's not Part D.
or B.
No, that's medical. So this is what is Part C? That's another name for Advantage plans. And the reason for that is you have hospital Part A, medical Part B, and then your prescription Part D. And it combines them all into one, so you get Part C. Okay, that's how they come up with that. They also just wanted to make it more confusing. Yeah. So it's on, you have it actually here on this sheet, the Medicare options for 2017. The third one, it's in blue. Okay, but the reason it's called Part C is because it's A plus B plus D. And for Medicare, that equals Part C,
So I
okay?
don't need A and B, I can just.
You
get C.
need A and B to even have a Part C.
And I'm happy with it.
And they take
Yeah.
$183 out a month.
I said to ignore these prices because they're different for everybody. It really depends on what your medications are and your health
And
needs.
if the medication.
Right, medication can be
And so for
expensive.
some people, it could be zero, like Anthem offers a dual plan.
Right.
That if you are Title 19 eligible, if you meet the criteria for Title 19, you pay nothing for your premium, you pay nothing for your copays. But it's only those persons that would meet the same criteria as Title 19.
Right.
So the numbers will not be, as Stephanie said, the same for all persons.
We have to go over that.
Right. Call choices counselor.
How do we find out what the amount is for Title 19?
It's on.
Oh, I
your
could give it
form
to
there.
you.
You have it. Down here in the blue. $972.49 for a single adult.
Where are we going?
Okay.
So we just skipped back to this because somebody had a question. All right, we're gonna get back to the games though. So now I think we've done, would you like to pick a topic in the back?
So we're gay, we're 1,000.
Medi for 1,000. Okay.
Oh, how do
Again-
you know this?
you just want to remember that it's like Medicare. It
This
could
is
be
the hardest question.
Medigap,
Yeah.
Medicare Advantage, like Medigap Advantage. So Minnesota, Massachusetts, and Wisconsin do not have standard versions of this. Something that starts with Medi. You want to say what is Medigap? We'll see. I don't remember the answer. Yes. There you go.
You win a Cadillac.
Don't spend all
Okay. So we're going to come back around to the front here. You don't want to just pick one. You don't have to answer it. You could just pick a topic. No? Okay. How about next to you?
Mary, pick one.
Pick one.
Yeah. Any column
The 400.
for which column?
Look up the top, which one?
Prevent benefits.
Preventative benefits for 400. I think this one everyone should know this one. If you've had Part B for longer than 12 months, you can get this visit to develop or update your personalized prevention plan. I'll give you a hint. When you go onto Medicare and you're on it for the first time, you get what they call, it's a welcome to Medicare wellness visit. So that's when you're welcome to Medicare.
right.
Okay, so that's my hint.
So you get a visit.
Annual checkup?
Yeah, we'll go with that. It's actually an annual wellness visit. They don't call them checkups or physicals in Medicare, but that's,
So when did you go to your doctor? So, right?
yeah,
You go to your doctor.
It's just your annual checkup.
it's a checkup. But they call
You
it,
can go once a year.
Medicare language is annual
I
wellness
got a
visit.
doctor once that wants to see me every 3 months, and I don't know why.
Well, so that's not a checkup though. That would not be billed as an annual wellness visit. Medicare has strict codes on what they can bill under and what they
Yeah.
can't. So, okay.
So your monthly, your yearly annual fiscal is billed under the annual wellness visit?
That's what it's called, yeah, when they do the billing and coding.
Well, that's about right. You should have,
Yeah,
I mean, for help.
it's preventative.
Every 3 months.
It's a well, if it's 3 months, there's something else you need to talk to your doctor about, because
Well,
he's,
I just want to get rid of
I
it.
go every
I think
6
it's kind
months.
of,
what was that?
I go every 6 months.
Oh, okay. Whose turn is it here to pick a topic? Yep,
Okay, I'm gonna say fun with acronyms for 800.
okay.
Oh, you shorted her 400.
you want to
Oh, I'm sorry. We'll do the 800 next. You'll get a twofer, okay? You get 2 of them. We're going to do the 400 first though, since it's up there.
get the whole 1,200.
So think about this. We talked about it earlier. It's one of the reasons someone could be on Medicare under 65. This person generally has to go to dialysis.
Oh, really?
End-stage renal disease, that's it.
Chronic.
What is end-stage renal disease? Okay, so here's you said 800, right? There we go.
She's a nurse.
We had a question in relation to our former president under this.
Some kind of
The
act.
Affordable Care Act.
Yes.
There you go.
What is the Affordable Care Act? You guys are a bright bunch.
We have a valedictorian in the group.
All right, your turn.
Potpourri, I'll just say 200.
For 200? Okay.
The year legislation is passed to create.
A lot happened in this year. It was a good year for our country.
Okay. That was
63.
Close. You get more.
Didn't have to be, anything to do with.
It was in the 60s.
In the 60s.
Oh.
62.
No? No.
65.
What is 65? Yeah.
Oh, see?
Yeah, a lot was going on in the 60s. So.
Yeah.
Okay, your turn.
Ooh, I'll have the ABCD 800.
Okay.
Inpatient. Ooh, that either could be A,
Yeah.
It is.
It's hospital.
That's the main thing you want.
Yeah, that keyword in that one is, what is part of, see, that's the fun of this game though, is you get to learn.
Then you said C, A, and C.
So C is a Medicare Advantage plan. So they combine your hospital, your medical, like Anthem, you have to go to Anthem doctors, or, if you have United Healthcare, they don't take Yale, so it's not a good plan to have for this general area, unless you know that your doctors do it, but I've run into instances where somebody goes to Yale's emergency room, and they have United Healthcare Medicare Advantage plans, and then they're paying an out-of-network fee. So it's, it's just something you have to look very closely at before you go. Yes.
What is Yale located?
Without explaining it.
Yes.
What is Yale located?
United Healthcare, Medicare Advantage
Hospitals
plans.
have contracts with health insurance companies
Yeah.
to accept a certain dollar amount of per diem rate, your daily rate. And they negotiate that contract. And last time around, Yale, New Haven, and United Healthcare could not agree on a per diem rate. So if you had United Healthcare, if you were having an emergency, such as like a heart attack or something, you could go to the ER at Yale, you would get treatment.
Yeah.
But if you had a planned visit, like knee replacement, something like that, you could not go there. You have to go to Midstate, you have to go to an older hospital. And if you're older and you have a spouse, it makes it also difficult for that spouse to visit you, come get you, bring you home, whatever the case might be. So it was not to your best interest, when you have other healthcare choices, not for your best interest to use a health insurance company like United that is not accepted by Yale or Yale doctors. And that
Yeah, that's,
became larger when Yale New Haven Hospital began to buy medical practices. So now you could not only go to Yale New Haven Hospital, you could not go to these practices that were technically owned by Yale New Haven Hospital. Well, don't worry, but I've changed you already.
I do go to doctors that are Yale doctors. And
So you have a supplement though, right? Don't you have a Medigap? So that's only Medicare Advantage plan.
And they pay.
But you have a supplement. You have a Medigap plan. Medigaps, remember my story about my grandpa? You
Yeah.
can go anywhere. There's no networks there. You go where they take the red, white, and blue card. That's the difference. That's why but you have that luxury because of the Medigap
it
plan.
costs more.
It costs more, but you get more
And
freedom.
If she's
So I can
traveling,
go to Yale. I do go to Yale.
Yeah,
Yeah.
yeah, and you can because your insurance allows it.
Yeah.
Okay.
Oh,
All right, let's move on. We know I'm gonna get hung up on United Healthcare. Next thing you know, we'll get phone calls, so. let's, who was next? I lost track. Oh, I like your bag. All right,
Thank you. Fuckery regulating.
okay. Oh, it's our daily double. We went over this. I'll give you a hint. It's in the green. Green.
Not one more. Well, I got five.
It's the name. They're looking for the name of the program, and every state
Yeah.
has one.
Well, there's
That's the
three
level
of
of
them.
it. That's your name and the levels of it.
she's,
Look at the very top.
The,
Okay.
Medicare savings
program.
Yes.
Yeah.
What is the Medicare Savings Program?
It's the additional low income,
Well, those are the different levels of it.
yeah.
So,
Could you put the other part back? What is it? Yeah.
the state program that helps pay the premium for Medicare, deductibles, and the co-insurance. So those are, well, I'll just show it on the sheet so everyone can see it again. This section here in green, that's the Medicare Savings Program. So think of Medicare Savings Program as an umbrella, okay? And then they have the 3 levels below it based on what your income is, okay? Okay, next up.
We'll go to potpourri again.
For 600 or 400?
I'll
I'll do 400.
Okay. This is a fun one. The first person on Medicare.
Claire.
I'll give you a hint. He was a former president.
What's that?
He was a former president.
Obama.
No, he's not. He's not on Medicare. No.
When it was 1965,
Actually,
right?
you know?
When it came out in 1965,
Yeah.
it was lost, what a
Who was
president
there?
was then,
Reagan?
around there.
I'm not a history teacher. So
Well, it
that's-
started in
You guys want to take a gander at it, or let's just go?
I'm trying to
What's
think
the
what,
answer?
Well, I want to see if they still want to figure it out.
I don't think it's Republican, because
Oh, well, let's not even get into the parties.
I'm looking into the.
Who is Harry S. Truman? Okay.
That was way before. He's the one that wanted to drop the bomb, that was before the 60s.
Okay. Sir, we're back to you. Would you like to pick a
And my
Yeah, do the
history's
Medi 400.
Medi for 400? Okay. So again, the beginning of this word starts with Medi. In Connecticut, we call it Husky.
Yeah.
Is that Medicaid?
What is Medicaid?
Yeah.
Or Title 19?
I'd like preventative benefits for 200.
All right, we're closing it out.
A flu shot.
Yes. Yep, what is the flu shot? Okay. And we'll just come over to you and then come.
You can pull 3 for 6.
Okay. Yeah, I think you know the answer to this one. You said them earlier. Oh, wait, no, never mind. Sorry. If a doctor accepts this, he or she accepts Medicare approved amount as payment in full. This is a tricky one.
Assignment.
You. What is assignment? Somebody worked in a medical office. You're still okay? You don't want to?
Yeah.
Okay.
Medi for 800.
Medi for 800? Okay, this is the payer of last resort. So we just had this one in a different question. This type of program pays last. Either Medicare, Medigap, or Medicaid.
Pays less,
Pays last.
last.
Medicaid.
Yes. Yeah. What is Medicaid? Okay, we're coming all the way back around to the front here. You still good? Okay.
Mary.
Mary? No, Phyllis.
Would you like
Pick
to
one. Pick one, Mary.
Let's try the 600.
For Medi, ABCD, or fun with acronyms?
ABC.
Okay. Okay, so this is the part of Medicare that it helps pay for canes, walkers, hospital beds.
Me?
Yeah. Yeah, what is Part B? Okay. You got slim pickings.
Medi for 600.
Okay. Did I hear it? What is Medigap?
I'm sorry, what was the question again? Can you go back?
It was sold by private insurance companies. These policies fill in the gaps after original Medicare plays.
Or supplemental?
So it's Medigap or supplemental. Universally, they're known as Medigap plans. Okay, but you'll hear, like we're talking about it now, like Part C, Medicare Advantage, Medigap
Get
supplement,
what from AA?
Title 19, Husky, Medicaid. They're all interchangeable. Okay? Okay, next up. Yeah?
Fun with acronyms, 200. CMS, Connecticut Medical Service.
Close. Very close. So there's actually a hidden M in there. Centers for Medicare and Medicaid Services. So anything that you get, like you'll get your Medicare Me and You book. It's about the size of this piece of paper, about that thick. And it's from CMS. They send you out your Medicare stuff. Okay. I think their headquarters is in Baltimore.
It's a lot of paper
It is a lot of paper.
per year.
Okay.
I'll try the ABCD 400.
Okay.
I got it. Don't. It's gotta be the last,
Yeah. We heard it over here is what is Medicare Part D. This is what I tell people new to Medicare. It's the easiest way to keep the parts straight.
because I
You
have,
hear Part D, think drugs,
I have part
right?
D.
What?
Drugs. The word drugs starts with a D. So, and that's your prescription coverage. Yep. It's easier to connect the dots that way.
Medicare does have.
Okay.
Never mind, I stand for my own question. I got two things going on.
Yep.
This category 6.
You want to do the fun with acronyms for 6? I don't know why they call it fun with acronyms. It's not that fun of a column, but we just had it in another question. So it's a cane, a walker.
The D,
No, we're looking at what DME stands for.
something medical equipment.
Mm-hmm. What's the D stand for in this case? No, not department.
Division?
No,
Deductible?
no. Durable. Durable medical equipment.
Durable. I was thinking
Some
about
equipment is not
that. It should be
durable.
durable. I don't know. You guys are making me clap.
Okay. So we'll just, do you have a choice of which 200 you want to close out with?
Not too many.
Medi? Okay. It's what we've been talking about all morning. Health insurance for people 65 and over, or Social Security disability, or who have end-stage renal disease. Yeah.
That looks okay.
What is Medicare? You got it.
Thank you. You have to have that disease to have it. It looks.
If you're under 65, if you're under 65,
65, be disabled or have.
and if you're disabled, you have to be disabled for 2 years.
Or that would be a chronic, that medical problem alone would be a disability chronic, and it's a health.
So we're talking Social Security disability for 2 years, and then you can have Medicare. Or if you have end-stage renal disease, it doesn't matter. Like there's 18-year-olds on Medicare because they have end-stage renal disease. Okay, so it's, most people who are on it are over the age of 65. That's how they got it. Okay, the other majority of people that have it are because they're on disability for more than 2 years. But there are some cases where somebody younger has the end-stage renal disease. Okay. So this is Part A, B, C, or D. This covers doctor's services and outpatient care.
B.
What is B? Okay, so A we know is the hospital. D is the drugs. The B is the medical. It's also the durable medical equipment is under that one. Okay, and we have a final question here. Okay, we don't have a wager because we just played for nothing. Just for our pride. This is the provision that mandates that certain types of insurance pay healthcare bills first and that Medicare pays second. You got me.
That would be what, HMO, I mean, a company and a private, kind of private.
I don't know. If you have ideas, throw them out there because I really don't know the answer to this one. Our wager was invisible money, so you guys don't have to worry about losing anything if you get it wrong.
Don't write that down.
Okay. All right, let's see what we've got here.
There's
Medicare secondary payers. So that's a really tricky one. I wouldn't
Yeah.
expect you guys to know
Now,
that.
when you
but-
exhausted that first insurance than Medicare takes?
No, when you,
It's like a two-part question.
so when you have Medicare, you can have, oftentimes Medicare is the payer, the first payee, your primary insurance. There's some cases, I can't remember them off the top of my head, I'd have to reference my Medicare Bible back at the office. But it's, some cases, depending on if you're working, if your spouse is working, how many employees that they have working there, you might have that group coverage first.
Income through.
So it depends on how many employees, but for most of you, your Medicare is your payer, okay? So,
Would you mind talking a bit about the difference between people who have traditional Medicare
Yeah.
with a policy that, supplemental policy to it, as opposed to a Medicare Advantage
Yes.
plan?
okay. That,
That's important to them.
okay, if everybody could just get this sheet out, the one with the Medicare options. So I'm gonna talk a little bit about the differences between the Medigap plans and then the Medicare Advantage plans, okay? So, because there was, I think we could use a little clarification on them. So we know the top part of it, that's Hospital Part A and Medicare Part B. Those are, that's what we call traditional Medicare. If you just wanted to leave it at that and get the Part D, then you're looking at the option number 1 down here in the pink. However, that's really not a good idea. I mean, it's the most basic coverage you can get, but you're still going to be paying the deductibles and 20% co-insurance. So if you went to a doctor's visit and it was $200 for the visit, right off the bat, you're paying $20 for the visit. Okay, or I'm sorry, $40 for the visit. And then if they send you for lab work, guess what? You're spending another 20% of whatever the lab costs. So lab work can cost up to $1,000. That could be $200 then out of your pocket. So it could just eat away at your Social Security check after a while. That's why people get either option 2, which is the gray here, or option 3, which is the Medicare Advantage. Let's look at the gray one first. Okay, those are Medigap plans or Medicare Advantage plans. I'm sorry, Medicare supplement plans, not to confuse you. See, it gets really easy to mix it all up. So we're looking at the Medigaps. This is the best insurance you can have. It's also the most expensive option. Some people, when they retire, are lucky enough to have their former employers give them money to put towards it in a health savings account. Some are just well off enough to purchase it. My grandpa, he works for the federal government, so he has a stipend that he puts towards his premium. But that's not the case for everybody. But if you do have the ability to get a supplement or Medigap plan, what it allows you to do is go anywhere in the country that they take the red, white, and blue card. And in addition to having that, so you'd have, not only you have your red, white, and blue card, which is traditional Medicare, then you'd have your supplement Medigap card. And then on top of that, you have your Part D drug card. So you actually would have 3 different insurance cards that you're carrying around. And when you go to the doctors or hospital, you're showing them the Medigap card and the red, white, and blue card. When you go to the pharmacy, you show them the Part D. Okay, does that make sense for everyone? Does anyone have any
Make sure
questions?
they're getting paid.
Yeah.
Good card.
Does anyone have questions on the Medigaps? Okay.
I have a question on Medicare and Medicaid.
Okay.
That ever be combined? I mean, Medicare and Medicaid. Can
What-
a person get off Medicaid and get on Medicare and Medicaid?
So when you become eligible, let's say if you're on Medicaid right now, and you're under 65, that's the only insurance that you have. You have your Husky or Medicaid. When you turn 65, you're eligible for Medicare. And because Medicare is a primary insurance to Medicaid, you'll actually get kicked off of the Medicaid until you sign up for Medicare. They won't allow you to just keep the Medicaid. That's something I deal with a lot with the people that I work with.
I know there's a lot of people that have that.
Because they're used to paying a premium, and then all of a sudden something comes in where, wow, I have to pay $134 a month. But that's why we have programs like the Medicare Savings Program that helps. So you have to remember, Medicaid is always a payer of last resort. If your income is low enough, then you can have both. But Medicare is paying first. Does that help answer your question?
Yeah, Medicare will be paying first, probably Medicaid will actually end up paying prescriptions.
No, you still have a Part D.
That's prescriptions.
Yeah.
Yeah.
So, but the Medicaid would be the payer of last resort. So a lot of things that people don't, that they lose when you go to Medicare is vision and dental coverage. They don't, traditional Medicare doesn't offer it, which actually is a good segue into option 3, the one in blue here.
Yeah.
We call these many different things. It gets confusing. So I'm going to run down the list of what names we have for them. HMOs, Medicare Health Plans, Medicare Advantage Plans, and Part C. And remember, A plus B plus D equals what?
C.
Part C. Yep. So these plans allow you to have dental and vision. What's tricky about them is you have to go in-network. So we spent that time talking about United Healthcare Advantage plans, how you have to go in-network. But even if it was something like WellCare or Cigna, if your doctor is not in-network with that plan, you either have to go to a different doctor or find a different plan where he or she is in network.
How many years can you change the plan?
That's a good question. So every year, there is something called open enrollment. It's the general open enrollment period. It's October 15th to December 7th. And that would be for your 2018 plan. So right now, whatever plans you have, you might be locked in, unless you have extra help. If you have the Medicare Savings Program, which is here in the green, and you have, then you automatically have extra help. And then you can change your plan any time of year. Okay, but typically, for most people, it's October 15th to December 7th.
For enrollment.
But if you're on the Medicare Savings Plan where the state of Connecticut is paying that monthly Part B premium, where you have that gray card that you show the pharmacist, you can change anytime you want.
Right. Let me see here. So, I think the difference between the two, like Medigap and Medicare Advantage plans, certainly the price. You know, Medicare supplement or Medigap plans, they're pricey, but I've seen them help out people. Not only like, let's say you didn't have a lot of money. Let's say you had something like cancer. Chemo's expensive. Radiation's expensive.
Getting
So-
sick is expensive.
Getting sick is expensive.
Getting sick
But-
is expensive.
So if you have a supplement plan, you're paying high monthly premiums, but you're not paying when you go to the doctor. So you're not paying co-pays. So that's the big difference there. Because with Advantage plans, some of them you can get for no premium. Really, the way that works is, you know, the higher you pay in premium, the lower your co-pays are. It's not that big of a difference, maybe $5 or $10 per copay. So, but you know, it's there, and they're generally like for people that maybe you're just starting out on Medicare. It's probably the most similar to the insurance that you had while you were working, and you're not very sick. If you are sick or have a lot of medical issues, it might be better to look at a Medigap plan. And again, just, you know, you see these numbers, and I'm sure you see that $388 a month, and you're looking at me going, yeah, right. Okay, because I would probably say the same thing if I had to pay that. That's for the Cadillac plan, like the best of the best. So that's a Medigap plan app. There's different types of plans with different rates. So if you guys are, you know, interested or need help during open enrollment, just feel free to, you know, contact our office and schedule an appointment. Or I think like the past few years we've done walk-ins from 9 to 11 from that October 7th to October 15th to December 7th date. Haven't heard much saying that we're not going to do it this year, so I'm assuming we'll move forward.
Yeah.
But just give us a call. Okay.
And we also look at this $388.10. Keep in mind, for anybody that I've put on the Medicare Savings Plan,
Yeah.
you're not paying that $134.
And you might not even be paying the $14.60.
So it could be less than that. That would be, you know,
So I do want to say
a fake
something.
high number.
I want to say something to that too, now that you brought that up. When you're on the Medicare Savings Program QMB level, so not just any level, but the lowest level, the one where you get the gray card, you cannot add a supplement plan. The reason for that is that that gray card is your supplement. Okay, that's the only level that does that. So let's say you're the next level up, SLMB, where you just have to make below like 2,300, okay? So if you wanted to add a supplement plan at that point, you could. But that's the thing with the QMB level, you just can't add or change a supplement plan that you already have. Let's say if you had one, like you have the United Healthcare one, right? So if you decided to get rid of that and you have the QMB, you would not be able to sign up for that Medigap plan up again so long as you have the QMB. And the reason for that is because the state is paying your supplemental portion. Now, the disadvantage to that is that you have to stay within the state of Connecticut. You can't, if you went to Massachusetts or down to Virginia, you wouldn't be able to use that gray card outside of Connecticut.
Make sure you don't get sick on a holiday.
Right.
Does Medicare or your insurance company that you choose, do they mail you a pamphlet telling you in every kind of field specialist, only the doctors that you can see and you can choose?
I believe that the insurance companies have their, what they call a provider directory. However, just from personal experience,
Yeah.
it's not always up to date. Like I have Cigna, I know it's not Medicare insurance, but Cigna's still a big insurance company. And when I was looking for, I wanted to find a psychiatrist, it was like, I called 30 different doctors, not taking new patients, some weren't taking Cigna. So it's always good to, I always double check. Check with your doctor and check with the healthcare plan that you're interested in. Okay? Because you don't want to hear it from the insurance company person will say, oh yeah, we have that provider in network, but it's not up to date. I don't know how often they're forced to, keep up. I know they have to have a certain number of providers that they offer.
And
So-
location has a lot to do with it too. Like I don't have a car, but I don't want to see a provider all the way up in Heron.
Well, that's something you have to think about then. And I mean, that's why we have the different regions of the states too. So for the Choices program as well as the Agency on Aging, we work within ourselves. So the Choices program is a program at the Agency on Aging, but Choices statewide. So is the Agency on Aging. We just have different regions.
Let's see the doctor local, like you had said.
Right.
2 months later, they're, I don't know, maybe because they're not getting paid quick enough or something.
I haven't seen doctors pull out of networks like that. Like if you're worried about them pulling out during like a treatment plan, like that usually, at least in my experience, I haven't seen that. And I've been doing this for almost 6 years. So the only one I've seen pull out was United Healthcare from Yale. Yes.
I called my insurance company to get doctors.
Mm-hmm.
And they'll give me a list, and when I call, I say I have such a plan. They're not that network.
Yeah, so you've had that experience too.
Quite a few times.
Mm-hmm.
Stephanie, you had mentioned, oh, I'm sorry. Is that it? I don't want to interrupt you.
So what
You had mentioned people with a gray card cannot have a medical supplemental plan.
If they sign up for the Medicare Savings Program
Right.
and they already have it, they can keep it. And then if they go to, they can't, like if they get rid of it, they can't get it back and they can't change it.
Okay,
As long as they have that QMB level, which is the gray card.
right, but they do need to sign up for a prescription.
Yes, you need to
So
have
the
a Part D
medical,
plan.
they would not necessarily have, but they need to sign up for a prescription carrier.
They may not have a supplement plan, but you absolutely need to have Part A, Part B, and Part D. That's the basic. If you don't have those, you're gonna get penalized. Okay, like my grandmother, I don't know how long it had been since she didn't sign up for Part D, but I know the penalty is so large now. She's 83, okay? She can't afford her prescriptions. But when she first, I think in 2006 is when prescription coverage just became available for private insurance companies to sell. And she wasn't taking any medication then. She has scoliosis so bad, her spine's cracking into her ribs, and they want to remove her ribs, but they can't, So it's, painkillers are what they want to give her, and she can't have a Part D plan because the penalty goes off of 10% of the federal plan premium, which I
Right.
think this year is like $34.
And it's for every year that
They
you
change
did
it.
not participate.
Yeah,
It's
yeah,
not
so
a
if you went 5
one-time
years,
shot.
it's a 50% penalty.
Yeah,
So it gets really expensive.
Holy mackerel.
Yeah, so get your Part Ds. Even if you don't have any medication, there's a plan that's $14.60, okay? It's chump change when you think about what the penalty could
I
be.
suppose you never go to the hospital at all. I mean, you're paying premium, because it's there, but you're,
Well, if you worked, you're not typically paying a premium for the hospital. Is that what you're referring to?
no, I'm not working, I'm not going to hospitals. I'm going to clinics. like
Okay.
Shoreline, East, Stony Creek.
Okay.
It's just because I figure it's a lot cheaper than sitting in an emergency room, price-wise, and not
A
staying
lot
alive.
of, most of when you're on Medicare, I think the copay, I don't have the info in front of me, but ER visits or even outpatients are just $65 copay.
They're not, no, I've got insurance, it's already.
Okay, I'm misunderstanding your question.
Suppose you just try to avoid, to try to stay at hospitals.
Okay.
You know, you're paying premiums every month, but.
Well, you're gonna pay the premiums regardless. It's just like car insurance. Like if you have a car, you can't just not have insurance on it, because then if something happens, then you're in trouble. Health insurance is the same way. You pay the premium so you have the coverage for when you need it.
I know, it's just one of those things like why, like they're trying to make you buy something in the area you don't really need it, and you don't really need it.
But you don't, I mean,
You don't know when you need
you
it.
don't know. You don't have a crystal ball. You could have to go to the hospital. You know, and you could, I mean, I would talk to Lisa here and see if you qualify for the Medicare Savings Program when you do turn 65, because she can help you apply for it.
Yeah.
And then you really don't have to worry about those premiums.
Because I avoid my doctor, I go to food, buy food at Stop and Shop, I go,
Mhm.
okay, let's give me a flu shot. Run Taylor, all the way up to New Haven, I don't have a car, to my family doctor to do it. It just seems more wise and so simple.
So you have to do what works for you. Everybody is a little bit different.
Yeah.
But you don't have a crystal ball, and you do get penalties for not having it, so I can't stress enough the importance of just, even if you just have the basic coverage, that's better than nothing. Okay, anyone else with any other questions? Okay, I want to thank everybody for having me out today. Take care. Do you want these?